Hi all, Kensiba here from AJINORAH. So here I am going to discuss you regarding information gathering. So you all know that assessment criteria have been divided into linguistic criteria and clinical communication criteria. The first one is that in clinical communication criteria, information gathering is one of the criteria. And it is again divided into 5 criteria. The first one is facilitating patient's narrative with active listening techniques, minimizing interruption. The second one is that using initially open questions, appropriately moving to closed questions. Third one is not using compound questions or leading questions. The fourth one is clarifying statements which are vague or need amplification. And the last one, fifth one, that is summarizing information to encourage corrections or invite further information. Listening to the patient's narrative, particularly at the beginning of an interview, enable the health professional to more efficiently discover the story, hear the patient's perspective, appear supportive and interested, and pick up cues to patient's feeding. Interruption of the narrative has the opposite effect and in particularly generally leads to a predominantly biomedical history, omitting the patient's perspective. The second one is using initially open questions, appropriately moving to closed questions. Understanding how to intentionally choose between open and closed questioning style at different points in the interview is of key importance. An effective health professional uses open questioning technique first to obtain a picture of the problem from the patient perspective. Later, the approach becomes more focused with increasingly specific through still open questions and eventually closed questions to elicit additional details that the patient may have omitted. The use of open questioning technique is critical at the beginning of the exploration of any problem, and the most common mistake is to move to closed questioning too quickly. Example, open-ended questions, tell me about your headache. And regarding the closed questions, do you ever make up with a headache in the morning? An effective health professional uses open questioning technique first to obtain a picture of the problem from the patient perspective. Later, the approach becomes more focused with increasingly specific through still open questions and eventually closed questions to elicit additional details that the patient may have omitted. The use of open questioning technique is critical at the beginning of the exploration of any problem, and the most common mistake is to move to closed questioning too quickly. For example, open-ended questions, tell me about your headache. The use of open questioning technique is critical at the beginning of the exploration of any problem, and the most common mistake is to move to closed questioning too quickly. For example, open-ended question, tell me about your headache. Closed-ended questions, do you ever make up with a headache in the morning? The next one is not using compound questions or leading questions. A compound question is when more than one question is asked without allowing time to answer. It confuses the patient about what information is being asked. It introduces uncertainty about which of the questions needs to be answered. For example, have you ever had chest pain or felt short of breath? The last one, clarifying statements which are vague or need amplification. Clarifying statements which are vague or need further amplification is a vital information gathering skill. After an initial response to an open-ended question, health professionals need to prompt patients for more precision. After an initial response to an open-ended question, health professionals need to prompt patients for more precision. Clarity to completeness. Often patient statement can have two possible meanings. It is important to ascertain which one is intended. For example, could you explain what you mean by lightheaded? And the last one, that is summarizing information to encourage correction or invite further information. Summarizing is the deliberate step of making an explicit verbal summary to the patients of the information gathered that far. This is one of the most important of all information gathering skills used periodically throughout the interview. It helps with two significant tasks: ensuring accuracy and facilitating the patient's further response. When you say dizzy, do you mean that the room seems to actually spin around? I hope this session was really helpful to you. So please make use of these sessions while doing your speaking. Thank you.